So my favourite skin cancer story, I suppose, about a doctor who's chosen to upskill was a doctor who was from over in Perth. And in 22 years, so he was actually an American, married an Australian, shifted over. In 22 years, he had not diagnosed a melanoma. Now, that's not saying he hadn't referred strange looking things out to somebody, but he hadn't actually directly diagnosed one himself and treated it, definitely. So he came along and did the course and then went back, and over the next 6 months, he diagnosed 4 melanomas. And when he diagnosed the first one, he emailed me. I was so excited, and it was wonderful for him to experience that. But the interesting thing is the fourth one he sent me through. So at this point, I then rang him up and I said, look, doctor, it's wonderful you're doing all these skin checks and you're now picking up all these melanomas. And he said, well, Paul, number one is I actually have been too busy just in my normal practice. I'm not doing skin checks. These are just patients that have turned up, taken off their shirt, suddenly have found something and gone, what's that? And then put the dermatoscope on it and then diagnose the melanoma. So these are incidental findings. So he was never actually physically looking for these things. I mean, so part of it for him was, what have I let walk out the door previously that looked exactly like that potentially was a melanoma? But the interesting thing about this fourth case, it was a 16-year-old girl with a level 3 on her hip. So if he hadn't picked that up, she probably would have been killed. And that story was actually turned into a national news story coming into summer to encourage people to get their skin checked. So that's one of my favourite stories, is that particular case of the difference that made to that doctor and to those patients. And actually I spoke to the family or the mother of that particular girl, and she was so grateful that we obviously helped upskill the doctor, but the doctor actually did that training. So one of my other favourite stories, I think, as part of the journey of learning, is that we get to see doctors once again, sort of time and time again, and see how they've developed over time. And one of my interesting story was a doctor in Brisbane, and he'd shared that basically going from the basic level course, where he diagnosed, somewhere around about 80 skin cancers over the next 12 months. Now, he's a generalist GP. Once again, he's not doing anything special. These are just patients that he's seen. Since he did the next course, being the advanced certificate course, he's now diagnosed 132 skin cancers and picked up 3 melanomas. Now, out of, so that's 3 lives definitely saved. Out of the 130 other skin cancers, obviously some of those would be aggressive and potentially could be lethal as well. But it was just interesting that he's tracked with his pathology company every time he's done the course, how many cancers he's diagnosed, as learning more about the subject. So that was just fantastic to see that going from the basic course to the advanced course, his pickup rate has increased by 50%. So I think the important aspect of just tying those stories together is the fact that the importance of, or the value, and obviously doing the education. I mean, these are skills you will have for life. You will find something you would have missed before that could potentially kill the patient. I mean, you're actually going to physically save lives by having these skills. So the fact that if you're a doctor and obviously you care and you want to help your patients, this is one essential skill, particularly once again in Australia, because of the commonality of it. The other thing is the patients are very, very, very grateful. I mean, you can imagine if you picked up something that the patient wasn't aware of, and it turns out it was a melanoma, you saved their life, they're going to be eternally grateful to you. I mean, they're going to be telling all their friends, obviously, how wonderful you are as a clinician. And once again, making that difference, because if you did miss them, and obviously that patient then died, imagine how conversely how you would feel, knowing that maybe that was something you could have picked up earlier that obviously did get missed.